The next speaker is Dr. David Spellmeyer from IBM. We are now switching to economics.
I'm going to be talking about a concept in which what we want to do is to incorporate many of the items that you've been hearing about, how one can take multi-sensor networks and collect that data and then make use of it in a financial way to benefit individuals in a large sense. IBM has takes a big picture view in a couple of areas. This year we've done one called the Global Innovation Outlook, in which we've identified certain areas that we think are ripe for tremendous amount of innovation. And one of those is exactly what we've been talking about, getting all of the data together and networked so it can be used for research or for benefit of patients. That's a core issue. One that I won't be talking about that is also extremely important as we do this is the responsibility of the government to its citizens in order to keep privacy and security as a fundamental issue in these. And I'm not going to talk about the last one. So it is recognized worldwide that healthcare is one of the last industries to actually go from a paper-based society to an electronic society. And we have to make this happen. We are spending tremendous amounts of money in the U.S., $1.6 trillion a year. It's 15% of our GDP. Worldwide, that's a little higher than most, but it's not dramatically different. We also, in the U.S., are killing about 100,000 people a year because we don't have access to these sorts of records, medical errors. The U.S. government is not in a position to manage this, both from a financial perspective and also from a trust perspective. And so in the U.S., this is going to necessarily be a public-private enterprise investment, and we need to really leverage a private innovation to make this happen. The cost, controlling medical costs, as we've heard, is absolutely essential. If we can continue to spend more and more money on healthcare, we will in fact bankrupt large corporations as well as small corporations. So we are looking at the idea of modeling the healthcare ecosystem on the financial ecosystem, and trying to ask the question, pose the question, the hypothesis that if we take many of the processes that we know and trust from our banking industry, from our financial markets industries, from our insurance industries, that we might in fact be able to model a way in which the information that is put online can be shared for economic benefit for all concerned. The idea is to use those principles, possibly the structures, architecture in a little a, not the large architecture in social, economic, and environmental issues as well as technology. But then look at the mechanisms of how information is delivered, how information is used, how customers actually, what services are provided. We believe that the idea of development of a new industry or an evolution of the current industries to something called health record banks, or if we look at the multi-sensors that we've been talking about, the vast amount of data that we're going to gain from those, the health information banks. How do we create this industry? We're starting a dialogue next week. We're having a large meeting down at IBM Almaden to pose this hypothesis to a large number of economists, a large number of healthcare providers, healthcare foundations, healthcare trusts, to agent-based modelers from the economics industry, et cetera, and working with a group of people from consumers and from Google and Yahoo and others to talk about how this might actually work and how we could evolve this from current players like our insurance companies, hospitals, employers, how government might be involved and how financial institutions, imagine a Fidelity or a Washington Mutual, and how their consumers might be involved. This, of course, will require government legislation and regulation to make it secure and private, and to make sure that we don't have, invariably, there are unintended consequences, and one of those are nefarious acts, and we have to plan for those up front. So the idea is, how can we get health information to be liquid? And by liquid, I mean exchangeable for financial benefit or for other value benefit. How do we actually reach all of the parties in the ecosystem and turn things from disconnected groups of data to something that is much more like this, where we really have a lot of data flowing, and then we look for the flows and exchanges of that information and make financial benefit to individuals, to pharmaceutical companies, to healthcare providers, to everybody. And with that, I think I will finish.